Very good morning, everyone. Very warm welcome to our very special meet and greet session with Nazia Ali. Panaji, we are ready to start.
Sure.
Just as all know, we'll be starting with prayer and then we'll be handing over and introducing Nazia. She will take us to the screening program. Thank you, everyone. Thank you, Panaji.
Good morning to you all. I was actually waiting for people to join in. So, yes, I don't think many people are quite keen knowing what bowel cancer is. So, we've got a special speaker from NHS called Nazia Ali. She's from the she's a community health coordinator from Brent Health Matters, and in partnership with the St. Mark's Hospital. Bowel cancer is UK's biggest, or sorry, the second biggest killer after lung cancer. However, if it's detected early, the survival rate increases significantly. I would like to invite Nazia to talk to you in better explaining than me. Nazia,
No.
all yours.
Thank you. Thank you, Panna and Arogyam, for inviting me to deliver this session. Um, as Panna has mentioned, I'm one of the community coordinator for Brent Health Matters program, which is a program of the council in collaboration with St. Mark's Hospital. So I'll share my screen, yeah, for the presentation to start. Can you see my screen?
Not yet.
Not yet. Okay. Yeah. Now?
Yes, we can.
You can? Okay.
Yeah.
So yeah. So what is what I'm why I'm here is like, because as Panna mentioned, the uptake of the bowel cancer cases are in fact increasing in UK, and the uptake of the screening program, the screening test is quite low, especially in Harrow and Brent. And that's why St. Mark's Hospital and Brent Health Matters, we have come in partnership to deliver these sessions to the community to create awareness about how important it is to take part in this screening program. Yeah. So going to my next slide. So what I'll be talking about today, very briefly, about what is bowel cancer, some facts and symptoms about bowel cancer, some of the risks associated with it, and I would definitely be discussing some of the barriers, what is preventing people from taking this test.
आज बड़े दुख था इसे
Sorry? Oh,
Sorry.
कोई बापे करीने था दुख थी
Um,
no problem. Yeah. Because I can't see the screen, that's why I'm
yeah.
okay. And yeah, no problem. And also, I'll be talking about what are the preventive measures we can take to avoid bowel cancer. So, if you see the screen here, this is basically the anatomy of bowel. This is the large intestine, which is represented by the brown color, and there is a small intestine. So, what happens is this bowel cancer, usually the screening program is detecting the bowel cancer in the large intestine or the large colon. Though sometimes, the polyps and the cancer can occur in small intestine, but the screening is all about detecting the polyps in the large bowel. So how it all starts? It doesn't start obviously suddenly as some cancerous cells. What it's how it starts is with the small outgrowths. If you see here, it starts with within the inner lining of our colon, in a healthy colon, and these small outgrowths are called polyps basically. And if these polyps remain undetected, what happens is like it turns bigger and bigger and turns into a structure called adenomas. And these are the adenomas that turn cancerous in later stage if it is not removed at the right time. So removing these polyps before they turn cancerous is basically preventing bowel cancer. And I'll discuss how it's done and how the screening program helps us. Before that, I would like to discuss some of the facts regarding bowel cancer, some of the statistics. So, as of now, around 42 to 45,000 cases of bowel cancer is detected every year in UK, out of which around 16 to 18,000 cases, result unfortunately in deaths. But the good news is like 53% of those bowel cancer, uh, you know, the, of those cases can survive for 10 or more years if they are detected at a very early stage. And among all these cases, around 54% of those cases are preventable. I'll discuss a bit on this in detail. Before that, let's see some of the bowel cancer symptoms, because if you just when I run through it, you will see that these are the symptoms which are very normal to us. We do experience these things very in day-to-day life, for some other reasons. But these bowel cancer symptoms, basically, if it persists for more than 3 weeks, it's very, very important that we see our GP. So what are those? Is one is when you observe some change in bowel habits, where we start going to toilet more often, and we experience tummy pain or looser stools. If we see some blood in our stools without any other causes like piles or hemorrhoids, or usually after eating, if you are experiencing some abdominal pain and discomfort or bloating, and of course without any specific reason, if we are experiencing weight loss and extreme tiredness. So these are some of the symptoms of bowel cancer which need to be, sorry, so which we need to be careful about. So if it lingers for long, please do visit.
Infectious energy, but she's far from your average grandmother. She's quite the character and an impressive.
um, Hello. um,
It's okay. I've
no,
done it.
yeah, sure. So what is this bowel cancer pre-screening program all about? One of the biggest barrier, what the statistics have shown is like people don't take this test because they think if I don't have any symptoms, I don't have to take the test. But this NHS bowel screening program is all about asymptomatic people as well, because this detects those polyps and adenomas before the symptoms becomes apparent, basically. So what this screening does, it people, anybody within the age limit of 54 to 74 years are automatically sent a test kit to their address. Of course, it's very important our address are updated with our GPs. So we do get every 2 years this kit, and if you receive the kit, it's very important to do the test kit even if you don't experience any of those symptoms, because it is a symptomatic screening program. So coming back to the image where we discussed earlier, is like the bowel cancer starts with a small outgrowths, it becomes bigger and bigger, turns into adenomas, and if it doesn't, if it remains undetected, it turns into cancer in later stage. Okay, so now it's very apparent that this screening program is preventive program as well for the bowel cancer, because what it does is, like I said, that polyps and adenomas are removed before it turns cancerous. But sometimes, even if cancer is found during the screening, it's usually in the stage 1 and 2. And if you see in the stage 1 and 2, it's just on the in a lining of the rectum, and these cases could be treated, and the cancer is highly curable at this stage. But if we neglect our symptoms, or we come to these and do this test when the symptoms become very severe, that means sometimes the cancer would have reached the stage 3 and 4, and that's when would have started spreading to other parts of the body. And that times it becomes little dangerous for the treatment. But definitely stage 1 and 2 is something which the screening program detects the cancer. So if you see the statistics, if the cancer, if at all, is found is stage 1, 9 out of 10 people will survive. And if it's found in stage 4, only 9 out I mean only 1 out of 10 people will survive. So what are the bowel cancer risk, basically? So as I mentioned earlier, that 54% of those bowel cancers cases are preventable. Why it's caused is because we these days eat too little fiber in our food. So one of the 28% of those cases are because of eating too little fiber. Another 13% is eating processed food, especially the processed meat, and also a lot of polyps and are developed in people who smoke a lot, who consume alcohol a lot, and obviously due to obesity. So these are few of the important reasons why bowel cancer is increasing in the community. So yeah. So how you reduce the risk? Like any other our health conditions, these are also some of the measures which we can take to prevent bowel cancer, like exercising regularly, stop smoking, reducing the consumption of alcohol, maintaining and achieving a healthy weight, and obviously eating a healthy and balanced diet which includes a lot of fiber, basically. So these are some of the preventive measures which we can take. But as we know, these not just prevents bowel cancer, but it also helps us, in preventing a lot of other health conditions as well. So, just a quick recap, avoid the risk factors. At the age between 54 to 74, everyone registered with their GP in UK is automatically invited every 2 years for the NHS bowel cancer screening program, where they are sent a fit home test kit. And this year onwards, they are lowering the age limit to 50 years. That itself speaks volume why, and how much bowel cancer cases are increasing, that they have to lowering the age basically to get more people do this screening. At 75 years, however, you people can self-refer if they experience some symptoms. So after 75, they're not automatically sent the kit, but they can always order their kit whenever they want. I'll share the numbers at the end of the slides where you can call the hub, and even we have our own Bent Health Matters number, just in case you're not able to reach the hub, where we can order the kit for you if you are above 75. And anybody obviously before below 54, if you experience any of those symptoms for a long time, please contact your GP, and probably they will order a kit for you. And as I mentioned, this screening program remove those polyps and adenomas before they become cancerous, and early diagnosis leads to effective treatment if at all cancer is found. So this is a picture of how the test kit looks like. Obviously, you will be sent, a small a box where you will have a small bottle and an envelope as well. So what you have to do is, I would like to demonstrate. I don't know if I can stop sharing my screen 1 minute. And yeah, can you see me now? Yeah, you can see me? Yes? Okay. So what you have to do is the test kit that I showed you, uh, how you take the sample, because many people are concerned about the hygiene issue and how do we take the sample, because if many of you have done this kit before 2019, the kit used to be very messy, where you had to take 6 samples, around 4 to 6 samples every day, in usually in that older kit. But this time the kit has become very easy. Taking sample has become very easy, and even the test has become very sensitive. So even a small sample, just 1 day of the sample is enough. So how it does is, like, if you see this, this is a small bottle which you will get in that envelope, I mean in that box. What you have to do is just any takeaway container, a clean takeaway container, put a tissue. If you want to wear a gloves, you can. Otherwise, anyways, you don't have, no way we are touching our stool. So what we do is, like, we pop the container in the pan of the toilet, take a very little sample, and obviously put it on the side. Just open this bottle. You will see, if you could see, there is a bit of some grooves on it. Yeah, can you see it? So what we have to do is, we just take this groove, this thing, and stick. And what we have to do is just run very quickly around the sample, just enough to fill these grooves. It need not have to be too much. And as soon as you take the sample, you just put it back, click it shut tightly, and there is a liquid, so be careful we don't drop the liquid. So once we click it shut, please do mention the date when you took the sample, because name and everything is all barcoded, so you don't have to worry about your name, date of birth, anything. But it's very important that you mention the date when you took the sample, and just pop it into the envelope, basically, and just paste it and post it. That's it. It's very simple, very quick, and definitely you don't have to touch your stool at all. Uh, in case somebody has that concern about taking the sample. So this is one of the barrier which people are not taking up one. And I'll also discuss few other barriers. So you can see my screen again, the slides. Yeah.
Yes.
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 Okay, so this is how the box looks like, and this is the envelope. Yeah. So, why people are not taking the test and the uptake of this test is quite low is is obviously the fear and the denial around the test outcome, because we always associate that we don't want to know certain things, because sometimes we have the fear that what if the things come out positive, what will happen next. But we have to keep in mind that I'll share something after this slide, where most of the cases, uh, the test kits which are returned don't need further treatment. So the denial and the fear we have to overcome, because it's for our own peace of mind that we take the test at the right time. And the another is obviously, as I said, the misconception that if I don't have a symptom, I don't have to do the test. Next barrier is about the concerns around the practicalities and the cleanliness of the test, which I right now demonstrated that it's very, very clean, very quick and fast. And generally, it's seen that more polyps are found in males, but but the statistics have also shown that it's the male who take less part in in this test. So it's very, very important that we, along with our partners or any male family members, we do encourage them to take the test if they receive these kits. So yes, and a lot of awareness program and is needed to actually tell people about the bowel cancer and the new kit and everything, and address all their concerns. Definitely. So we need such awareness program regularly in the community. So this is just a small statistics which shows from the St. Mark's Hospital. What we got is like, if 100 people have returned the test kit, 98 of them do not need further tests. So that means it's all normal. And even if two will need further tests, it could be just because they might have found some blood in the stool, which doesn't mean that you have cancer. It just could be due to other condition like piles or hemorrhoids. So it's quite clear that this test just detects blood in your cancer unless you are called for further investigation. So out of this statistics, if two needs even further tests, and if we make 100, out of those two people, a sample of 100, 13 will have a normal results. Nothing will be, they nothing. I mean, they won't be called further. 25 will have minor findings, and that might not need any treatment. But even if those 53, which is shown in this chart, uh, have been found positive, but that could be because they have found those polyps, which need not be cancerous, but it's so important to remove those polyps and adenomas so that we can prevent them into turning cancerous. So we can say that for those 53 people, we could have prevented cancer. And out of this sample, even if 9 would have got cancer detected, it's very likely that it would have been in a very, very early stage, and that's very highly curable in most of the cases. So we can see that it's so important for our peace of mind to take the test and be sure that nothing is wrong with our body. Okay, so St. Mark's Hospital, if many of you are aware, is just behind the Northwick Park Hospital, very local to us in Brent and Harrow. And this is a specialist hospital dealing with gastrointestinal diseases, and this is just one in the whole country, which has been awarded World Center of Excellence, and it's just one in 17 around the world. So it's very, very, if you're staying in close by Borough, you're in safe hand. It's very local, so we should take this opportunity to do, whenever we have been called to do this test. And finally, these are the numbers. Even I'll share some resources, soft copies, to the team so that they can circulate. So these are the health numbers from the St. Mark's Hospital, Andrew and Benazir, where you can call. And the first number is the self referral number, or any helpline, anything you want to discuss further about the test. And below we have our own health advice line, Brent Health Matters advice line. So where you can call not just for bowel cancer, but for your any health and well-being, if you're a resident of Brent. But even if you're not, then we can also help you signpost you to any other services we know outside our borough. Okay, so if you see there are a lot of resources available at St. Mark's Bowel Screen.co.uk, and in a lot of languages, it's resources are available. For example, Gujarati, Arabic, Hindi, Punjabi. There are a lot of resources, video resources, and everything is available for you to just go through once again. To understand how this whole program works. And yes, that's from me. Thank you so much for your patient listening.
Thank you very much, Nazia.
Question.
Has anybody got any questions? If you're shy to speak, then I don't mind you writing in the chat.
Yeah.
Panaji, can I just mention, Shamimji, that the resources and also the availability of these tests is very vague in different parts of the country. I remember 7 years ago, rather, my father had all the symptoms, but the GP was, GPs are not pro, I wouldn't like to even say pro, but they don't always refer you on. He was over 74, we asked for the test, and he said, no, it's not available, but didn't actually say that you can ring this number. So if there are anybody out there as patients who have symptoms, to go and see the GP and insist on the test.
Yes.
Just a comment, because I've been
No, definitely. These good you shared actually. So there are many screening hubs actually around UK. So St. Mark's is one of the screening hubs, which what I'm delivering in partnership with St. Mark's. So, but definitely the whole screening, the whole bowel screening program of UK should have this proactiveness. I just don't know. I mean, I can't comment. I mean, which part of UK, if you would you mention?
So I'm Leicestershire.
Leicester. Okay.
And it does differ different parts of the country.
I agree.
And I did go to a program where awareness and things, and this is something to point out to all of these participants, that they should be aware.
Yes, I will. I'll make a note, but yeah, I understand totally. The thing, it might work in different hubs and screening hubs around UK, because I think there are more than 7 or 8 screening hubs. I'll find out for you, but definitely what you mentioned is something they should be proactive, because this screening program is so important, and the cancer, as they themselves, the statistics have shown, is so much on the rise. So we have to be proactive. I'm sorry to hear that they didn't actually do it. So, but yeah, we'll make sure at least find out. Yeah, find your GP. You should insist. Actually, I think it's your right to get it. I mean, why not?
Yes.
Exactly.
And between the ages of 50 and 54, I think again you'll have to go in and mention to the GP. They won't just send it to you.
No, I mean that's what we are working on. As I'm sorry if I can't speak for other hubs, but with the St. Mark's hubs, I would say that what we do is obviously we they people can tell their GP, because sometimes what happens is like the address are not updated. Sometimes people change address. I'm saying not for you, but I'm saying most of the time what we got these issues was like address was not updated, and that's why they didn't receive. And even if you're not receiving, uh, you are actually eligible to get it every 2 years by default, if you are within that bracket range. So you please talk to your GP that this is the actually the general screening program, the NHS bowel screening program eligibility criteria. So yes, please do mention to them. Definitely hope it would have
Thank,
changed in these years.
thank you for mentioning that. But I think I missed the initial part of this little
Hmm.
what you're doing. The thing
Yeah.
is that if people have certain conditions like IBS or
Hmm.
conditions like so, they should go to their GP and mention, because those are the people who may be a little bit more prone to these conditions.
Yeah, because yeah, I understand, because there was one lady in one of my session, face to face session. Obviously, she had other colon issues, and other condition as well. So we didn't take the order of the kid, because it's very important that she goes to GP, and if GP refers for that kid, because sometimes they might be under some other treatment and some other conditions. So yeah, so it's very important if you have other condition as well, better first talk to GP and then order the kit. Anyways, taking the kit won't hamper your other, because it's just taking a sample and getting your test done basically. So it's not that taking any medication which would hamper your other conditions. So yeah, please do check with your GP. Yes, please. Anything else?
There is one question there.
Mm-hmm.
Please iterate that over age 74 and under age 54 to go to GP and ask for test if symptoms are there. Some GPs are not very. Oh, what happened?
Yeah, I can hear it.
Ah,
I can see her. I
yeah.
don't. Yeah, I don't know. It's available for this.
Some symptoms are there. Some GPs are not very pro and don't know it's available for these
Hmm.
PXs.
Uh,
It would be great to provide
patients.
the
Yeah. Hmm.
yeah,
Hmm.
provide the contact numbers. Whose contact numbers are you after, Nutan?
Hmm.
Because your GPs, you would be having the GP numbers.
So, Panaji, I'm just my own
Hub. Hmm.
experience with the GP. This was
Okay.
7 years ago. Unfortunately,
Okay.
my father was brought too late, but he had all the symptoms, and the GP never referred or never talked about this bowel screening. I'm sure
Okay.
it's
What-
a lot more apt now.
So Nutan, what I can do, I can try getting. You're saying you are in Leicester, yeah, yeah.
Yeah.
Uh, and what borough in Leicester? Like, what's the name of your council?
Yeah, 7 years ago. It's now too late for my dad. He's
Uh,
unfortunately passed
uh,
away 7 years
no,
ago.
no, no. Okay,
Saying
so
that
sorry to
people who
hear.
are still does and have certain symptoms,
Okay.
have IBS or these colon
Yeah.
issues.
So why
I
I'm
think
asking you if you can pass on to your even your friends and family what hubs and these screening hub falls under your under your area, so that you can, if anybody is in need in future, you can always tell them to contact, because as I shared my St. Mark's Hospital hubs contact, I can try getting it what is closer to your area, the contact, and pass on to you.
yeah. I mean, I think a lot of listeners today might be from Leicester. My dad, it was from Leicester City.
So Leicester
So
City is the that okay. Leicester City. I will try to find what hub and what numbers you can contact just in case you want to order your kit. Yeah.
yeah, and it is very important for the
Mm.
participants. It's very easy. I did one 2 years ago myself. It is
Mm.
very, very easy. I know I was a bit anxious, but once you've done it, it's a relief, especially if there's
Yes.
family history. And I think there's somebody who asked about IBS, irritable
Mm.
bowel syndrome, but there are a lot of conditions in the large intestine or small intestine that are make you a little bit more prone to cancers.
Yeah.
But it's if you know that you haven't got it, it's such a relief.
Relief. That's why, yeah, it's such a peace of mind. Definitely. That's why you got it done anyways. I think you got your kit, isn't it? Automatically sent to you, isn't it?
I did get it. I reached 54. Well, I think I was 56. I'm not sure. It was just after COVID. But
Yeah.
I'm due for another one, I think, this year or next year.
Yeah, so
So
in 2 years you get automatically invited, but sometimes it so happens is things might change within 2 years. So it's very important to keep an eye on your symptoms. So it need not have unless you don't have any symptoms. So wait for 2 years. But even within that 2 years range, if you see some change, please. I mean, obviously, you have to go through the GP for that pathway, because if you call directly the hub, they will say, oh, you are already in the pathway of 2 years. They won't send it again unless GP refers, in a special, with
we will.
reference.
2 years are up. I will definitely go back and ask for another one because it is so important, like you've said. Thank you, Nazir.
Thank you so much, Nutan. Yeah. Anybody else?
What is IBS?
I think uh 1 minute. Oh, I is a bowel syndrome. I don't know. Sorry if I'm mistaking the acronym. It's sorry.
Irritable bowel
Irritable.
syndrome.
Oh, irritable bowel syndrome. Okay, okay. So I think that is could be one of the symptom, you know, but it's just that. Yeah, so you're clear, right? I mean, it's just irritable bowel syndrome. It could be for many reasons. It may not be because of the cancer or colon cancer, but yeah. So we should be keep an eye on these symptoms and syndromes. Yeah.
People do not realize that from these tests, doctors find out so many things, and it's unbelievable. Like, for example, my husband had been called because he started having little blood shots, and
Mhm.
they asked him for to do this bowel test, and from that they found out other things, and which is why I'm so pleased that he did go and do it, and now he's being looked after this hospital in the city.
No, 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 definitely. That's why awareness is so important. So even if we are 20 of us listening today, we can pass this message to another 20, and within our family members. And it's so important that we keep talking about it. It's not a taboo to talk about it, because I know culturally people are scared to talk about it. People are scared to know the results. Sometimes people think ignorance is bliss, which is not.
Yes, it is. That's how Kishore was. He was ignoring. So, who wants to go right till the city? And I know
Yeah.
it is tiring, but it's for your own good. Why they calling you? Because there is something. They saw it, and you
Yes,
need to
and
be treated.
correct. And if you all are aware, as a, I think we are also called. I'm not dealing with it. I can't tell you detail, but we are called for even cervical screening, if,
Yeah,
from our GP. And frankly, many years before I was ignoring it, but
yeah,
since I have started doing these programs, I realize it's so important to do the screening if you have been called, you know
yeah,
even if any screening for that matter, if you're called automatically, if because we sometimes don't get time, and obviously and so when we need actually these screenings, sometimes the waiting period is very long or something, and but when we are automatically invited, we tend
yeah,
to ignore it. So
yeah.
it's good that we do it as for our peace of mind. Definitely any screening for that matter, I would say. Yeah.
Yes, absolutely, absolutely.
Mm.
So
Well,
one should be aware of the things what's happening to your body, and please, if something you come across, you must go and see your GP straight away, because something new is being developed in your body. You never know what it is, and like we say, you don't know what's around the corner. Yeah.
true, but no, true. So, any
Any
more
particular
question?
time of the day to do the test? No, I don't think so.
No.
It's any time you can do it.
Whenever you want to go to the toilet, you just take the sample. Yeah.
Yeah.
So it need not have to be any particular day. But earlier, I think before I that's why I mentioned it's very important that many people had maybe had done their kit before 2019. It used to be very, very different. Then even if you see, I think Google and see the 20 earlier, bowel cancer kits, it used to be very, very messy, and that had put many people off, from taking the sample and test. But this time, that's why I wanted to demonstrate as well, to
Yeah.
show that it's very, very quick and very hygienic per se. We can still wear gloves if you want to, and yeah. So
No, this is much better way of doing it. Some of them come with really tiny teaspoon, and I find it amazing. Even from that tiny little bit,
mm,
they get the results out, and
yeah,
it's wonderful.
because
Thank
the
you again.
screening is all about detecting blood in your stool. So that blood
Yeah,
could be because of something else as well.
yeah,
But if they find a blood, at least they'll call you for further tests and make sure that it's not because of those polyps bleeding into your colon, but could be because of piles or hemorrhoids, which could be treated very quickly. Yeah. So
yeah,
yes.
yeah,
Mm,
yeah.
thank you.
Any more questions? Oh, everybody's just understood you very well. You
Thank
did your
you.
job well.
Thank you. But I'm always available, so I'll share the some contact details with Panna, and
Yeah.
you can share with the people if they're staying within obviously Brent, Harrow, and Hillingdon. But nevertheless, the hubs are this program is for the whole UK. So
Oh,
if anybody wants to know about other hubs, some information about other hubs close to their area, please
yeah,
let me know, and I can find it through St. Mark's if they can, pass that information, and I can refer those numbers to you. Yeah.
absolutely. Absolutely.
Okay. Thank you.
Thank you
So,
very much, Nazia. It was
thank you.
wonderful to catch
Yeah.
up again and hear about the bowel cancer. It's it it's brings back everything, saying yes, you must do this, you must do that. So
Yes.
please, all the participants, listen to your body, and if you are requested to do a sample test, please do it. Don't ignore it.
Mm,
Thank you again.
thank you.
Yes, and we will share this recording. Is that okay, Nazia? We can share it
Oh, yeah,
because
yeah. I
people
don't mind.
are
Yeah,
asking
yeah,
for
yeah.
it.
Definitely.
Yeah.
No problem at all.
Okay. Thank
Thank
you
you.
very much. Oh, what type of medications are available for it?
See, that comes the more clinical side of it, and everybody body is different. Their health conditions are different, so uh, I can't comment, in any specific medication or treatment. But then it's the it's the duty and of the doctors to decide what medication will be suitable for you. Uh,
Yeah.
so yeah, so that would be best that you talk to your GP if at all there is a need
Yeah.
to take any medication.
Exactly. It all depends on the results of your test.
Yeah,
Yeah.
definitely. Okay.
Okay. Thank you very much again. Thank you,
Thank
all the
you. Take care.
participants.
Take care.
And thank
Thank
you,
you.
Nazia. We will
Thank you
catch
for
up
calling
again
me.
soon.
Yes.
And take care. And we
Thank you.
really do appreciate you putting your time in for us.
Absolutely,
Thank
my
you.
pleasure. Thank you so much. Have a nice
Thank
day, all of
you
you.
again. You
Bye-bye.
too. Take
Bye.
care. Take care.
Bye.